afternoon, everyone. Thank you for coming. Welcome. I see a lot of first-timer ribbons in the room. That makes me excited. I have a bunch of ribbons, so that's why I'm taking this off. I will introduce myself and then put this down. If you have not been in the link room yet during this conference, this is the room from which we are live streaming those who are watching us on Facebook. So that's why a couple of you were asked to move out of the way of the camera, and we're working with microphones and stuff. So we really appreciate your patience. Today we're going to ask you to go ahead and ask your questions as we go along. You're welcome to. We'll also take questions at the end. And Alicia is here from the GPA staff, and she'll let us know if we have questions coming in from our live streaming audience as well. So one of the things that's different this year about the conference is we introduce ourselves. And so the slide at the very, very end of the slides says who we are, and we have no one introducing us. So I'm Cheryl Kester. I've been a grant professional for years, since 1999. You can do that math. And I'm excited to be here with you today. And my co-presenter today is Kaylin Mason. She's been a grant professional for 5 years, and I'm happy to say that I recruited her to backfill my position when I went back to consulting. And so she agreed to come do this with me today. So you're going to be hearing from both of us on the topic of using data to strengthen your grant proposals. How many of you were able to go to that really great census session right before lunch? I'm as excited to learn some things in there. I think this is a really good piggyback because today I'm not here to tell you how to find something on FactFinder, and thank God for that since it's going away, right? What we're going to talk to you about today is how we use data in our actual grant proposals, from how we weave it in, how we put tables in, really complex proposals, and how we do citations. So, sorry, did I? Go ahead. It is Kaylin's job to talk to you about learning objectives. That was just my little preview summary.
Hello, thank you for being here. Can everyone hear me? Is the mic working? Okay. Sorry, I am sitting because I'm 5 months pregnant and I didn't know how long I could stand to just be standing up there. So I'm sorry if you can't see me, but hopefully you can hear me well.
Okay.
Is it working?
Better.
Is that better? Okay, great. So our learning objectives for today, we're going to learn how to use internal and external data in your grant proposals, identify sources of research and statistics, and learn best practices for citing data in your grant proposals. Why do we use data in the first place? This is what we'll cover today. You can use data to make a case for need to support your needs statement. You can use it to enhance the story of your community, such as size, demographics, characteristics. This is especially important when you're working with a funder or applying to a funder that is not familiar with your community or your audience. You can use data to demonstrate eligibility, establish baselines, link plans to evidence-based practices, and all of this serves to increase your credibility as an organization to funders.
So on eligibility, we're going to take a look. So I didn't get the bullets in quite the same order we're going to talk about them, because eligibility, I'm just going to treat it as one slide. We're going to kind of go quickly. So if there's a local funder that probably knows you or is familiar with your community, then probably all you have to do is just say, we are located in your home region. Like we have a couple of funders in our part of Northwest Arkansas that are very specific about what's their home region and where they will and will not fund. It's a 4-county region for one, and I think a 6-county region for the other. So we are located in your home region, or we will deliver services in your home region. Different funders have different rules, right, about what's the eligibility criteria there. Of Benton and Washington counties. Pretty straightforward. That may be all you have to say about eligibility, geographically speaking. For federal funders, I've often had to use an eligibility finder tool that they provide. So you're going to be wanting to dig through that 80 or 115-page NOFO to say, in the 11-point font on page 87 in the footnote, they say, you must use our eligibility finder at this website that's 3 pages, 3 lines long, and you can't click on it, and then print out a picture of the map and put it in your proposal to show that you're eligible. Sometimes you're able to sometimes it's easier than that. You just put in your address or you put in the zip code to determine eligibility. And then sometimes they just require you to check on a list. They may have a list of special needs locations, opportunity zones, for example. And so you can just find an opportunity zone list. And both of these, what I provided here, are just examples of There are links to real eligibility finders that were provided by real federal agencies. That's why they're in here.
All right, building the case for need. This is a key part of your proposal because funders want to know why we need their money, and data can help enhance the story that you're trying to tell your funder. We start by answering the 5 W's. Who are you serving? Where will you serve them? What is it like there? When do they need your services, and why do they need your services? So not only why do they need the assistance that you're going to provide, but why is it important that it comes from you and not from another organization? It's important to personalize all of those answers to make sure that you're telling the story of your organization and the work that you do. And data can help you answer each of those questions.
I would also say personalized to your community, right? So an example that we've used in Northwest Arkansas, and someone was telling me this about their region too, I think it was maybe the San Francisco Bay Area. Those 2 counties we mentioned, Benton and Washington County, if you just pull county level data, over the last 2 decades, the rates of income have gone up significantly and the average poverty rate has gone down. But that's because we are home to the world's largest retailer and 2 other Fortune 500 companies. I know Arkansas, right? And they have all their headquarters and all of their vendor supplier buildings are along this interstate corridor. So if you're able to take a county and slice it in half and say, oh, well, on the eastern side of our county, yeah, median incomes are up here, but in the western side of our county, median incomes are down here and unemployment is up here and access to services. So if I'm talking to a funder from outside my immediate region, sometimes you want to tell the story to explain why the situation is the way it is in your community, especially if you think it doesn't match their expectations. So what's going on in our state is everybody down in the capital in the center of the state thinks that our part of the state is rich. Well, part of our part of the state is rich, but there's still great need there. So that's another way to personalize the data to your community as well as those you serve.
And data can help support each of those W's that you're trying to answer. So who are you serving? You can talk about the number of individuals served or the number of individuals in your community or the area that you are going to serve with your program or project. You can give racial and ethnic makeup, demographics, things like age. All of that can help to tell the story of who it is that you're serving with your activities. Where will you serve them? So your town, what are the schools like? Are you serving people in particular counties or particular parts of counties to really get specific about where your activities are going to take place? And what is it like there? So you can really dive into some data and get some extra detail in terms of rates of poverty, educational attainment, what are health statistics like in the area, and things like that. All of that enhances the story that you're trying to tell. And again, why do they need your services? So weave facts and statistics into a picture to create a picture of the audience that your organization is serving with your activities.
So for example, if we're writing a grant proposal for a free health clinic, we're going to focus on those healthcare indicators, right? But some poverty things are going to play into that. If we're focusing on services to children after school in grades 3 through 6, then we're not going to talk about the healthcare indicator just much, but we might talk about grandparents who are raising their children, for example, or what other access there is to after-school services. So that's another way that you really personalize it. And I think there's going to be, while this session is primarily about data, I don't want you to ever think that we only ever use data. So we typically frequently weave in stories, either aggregate stories of composite clients that we serve, or actual client stories that we change the name. So we're always wanting to balance the data with the anecdotal, if that makes sense. And we're going to talk a little bit about that today, but we're primarily about data today.
So we're from Northwest Arkansas. I work for Walton Arts Center, which is a performing arts center in Fayetteville, which is in Washington County. And so we serve primarily residents of Fayetteville. So there we can provide, if we're telling that story to a funder that is outside the region, we can provide population statistics for the city of Fayetteville. And we also can note that we serve audiences from across Northwest Arkansas, which includes the Benton and Washington counties. And we can have a total population of that entire region, which is closer to 500,000. So that gives a better picture of the amount of people that we're serving. If we had just left it with the city of Fayetteville, that's kind of a smaller pool than if we open it up and say, well, actually, we're serving all of Northwest Arkansas, which is true, which is almost 500,000 people and growing rapidly.
30,000 people a year move into our region.
You can provide basic demographics such as race, gender, age, and that.
Yeah, and we've talked about that some. And so one of the other things that's on the slide is one example of how we will cite data. This is not a research paper, right? It's not even probably a research proposal to a federal agency. So I do go beyond just saying, well, I'm telling you the population is 73,580. Usually I'm going to tell you the census date that came from. Probably this was character limited, so I didn't even say this is ACS 5-year estimates. In a federal proposal, I would have done that. What other kinds of demographic data have you people in this room, what do you use in your proposals? Similar to these basics. Unemployment is a good one. Free and reduced lunches, because that can often be a proxy for poverty, right? Or even the poverty rate in the community can be at one level, and the free and reduced rate in a particular school can be at a much higher level, right? Very good. What else?
Opioid overdose rates.
Opioid overdose rate. So that's not a simple one to find, so we'll talk about that later. Good. Yes, sir.
Educational attainment, family education.
Educational attainment, family education. So not to put you on the spot, but give me an example of what kind of proposal that would be important to include that in.
The Department of Labor apprenticeship.
Absolutely. Department of Labor apprenticeship grants. So exploring how many people have already earned a college degree or a college credential, how many have only high school, etc. Very good. Yes, ma'am.
Poverty rates.
Poverty.
And, rates of children covered by health care or not.
Poverty rates and rates of children who are covered by health care or not. So when writing for free or reduced fee clinics over the last several years since the passage of the Affordable Care Act, we have said things like, despite the Affordable Care Act, this many people still don't have insurance. And I see some of you nodding your head, so you know that even if people are insured, they may not have a provider that will take that insurance, right? So that's how you stack your data. So it's not just one stat. This many people live in our community. This many people live in our community in poverty. This many people live in our community in poverty who do not have health care coverage. And then even those who do have health care coverage, we know that 95% of the physicians in our community willing to take Sooner Care or our care are not taking new patients. So that's how you would build a story. Very good. Okay, so this is an example of how we use data in an actual proposal. And actually, so there was narrative text on the side. This was about a 4-page proposal for one of those clinics I was telling you about. And we've woven in some pretty specific statistics. And so because I felt like that was getting a little dense and a little numbery, for lack of a better technical term, there's that little community snapshot that I made in a call-out box that the text kind of wrapped around. You can't see the formatting on the slide. I don't need to read the text to you. There was a supplemental handout that came with these slides today, and the people on the live stream, those will get sent to you. We're going to flip over to those a little bit later. I know it included some sources of data. Since you've got it right there, will you flip on and see if I included the complete excerpts from the proposals as well? Because I don't remember that I did. I did not. So if you have trouble reading these, our contact information is in the slides and also in the conference app. Like when you get home, I really would love to model one of my proposals after this and you can't read the text, reach out to us and we'll send it to you. And that goes for live stream audience as well. So sometimes you don't have data, or sometimes you need to talk about those you serve. So then what do you do?
So in an ideal world, all of our organizations would have internal data specialists, evaluation specialists who can gather internal data on the exact audience that we serve, and then we can use that data in our proposals. How many of us have that? One guy.
I think I saw three total hands.
Three
maybe.
total. Yeah. You're the lucky ones. I used to work for an organization that had that. I was very spoiled, and now that's something that I'm working on building for the organization I work with now. But if you have the opportunity to collect internal data, there are a variety of ways that you can do that. If you're in a health organization, perhaps you have intake forms that you can use to kind of have data in the aggregate about your clients. You might use surveys of your audiences, create focus groups, have personal conversations or correspondence with your audience that you can use to enhance your proposals. Perhaps you have, if you're at an institute of higher education, you have student records. And then if you're in a hospital or a clinic, you have patient records that you can use to kind of build an internal database that is specific to the audience that you are directly serving, rather than a look at your community that you then maybe have to extrapolate from to build a set of data for your proposal. If you don't have the ability to collect this data, you can use the local census.
We used to do that. We used to say we don't know who comes to all of our performances. We can't do a survey every time every audience walks in the door, and everyone knew it was not a very good proxy, but the closest we could find was a combination of our 5-year-old audience survey from one show and the local census of what's the percentage of different populations and income levels in our community. Of course, you might run into questions about FERPA if you're looking at student data. You might run into questions about HIPAA if you're looking at patient data. We're talking about using the data in aggregate. We're not talking usually about individual patient data. But I just want to go back a slide where we talk about the incomes of the people in the community. So probably my next paragraph might say what the incomes are of the people that we are serving at our clinic. So you take it from maybe the federal level or the state level or the community level, and then down to as much as possible, those people you're serving. So, guess what? I had a slide about that. What do you know? It's a good thing that I think the same way most of the time, right? So this was the proposal excerpt about the patients. So the first excerpt was about the community. What are the health and other economic conditions in our community? This excerpt is about what are the conditions of the patients that we serve. So I don't know how many of you are familiar with or have worked with low cost or free clinics in the past or currently. So what I'm finding over the years is usually when those clinics are opened by a well-meaning and committed physician or a group of church members, they expect that most of their patients are going to be coming to them with what? Acute needs, right? The infection that someone can't afford to go to the ER for, or the child who has an unexplained rash, or a cough that won't go away. What most of them are finding, and I want to know for those of you in this room, if you're finding the same thing, that most of their patients need, it's chronic care management, right? I'm seeing a lot of heads nodding. So the reason this person fainted was not because she had a seizure, but because she can't manage her blood sugar because she can't afford her strips to test on a regular basis, or she doesn't know proper nutrition. So we're talking about, we found out at Mercy Clinic that we need to help people manage their chronic illnesses. Why is this challenging? Because it's basically a general operating request, right? Because you're constantly going to need those recurring supplies. So we talk about the high degree of cardiovascular disease, what percent have pulmonary issues, the fact that some have more than one condition, and then we go to the State Department of Health in Oklahoma and say the entire state has declared these to be high need areas. So you're constantly, it's hard to illustrate this, but you're constantly weaving back and forth between what do we know and what do experts say, and what other data can I find and what data can I not find. So all I can go with is the state of Oklahoma saying these are kind of big deals, because the state of Oklahoma didn't really have was good county level data for us on these particular health issues. Does that kind of make sense, what we did there? Okay. So, is this mine too? Mm-hmm. So where do you find these external data? Well, we all know, well, not all of us, maybe we didn't all go to the session, but we know about the census, the decennial census, which takes place every 10 years. But if you're using the census data at all on a regular basis, you probably already are using the American Community Survey data, because that's going to be more current, especially like we are now. We get so close to the end of that 10-year cycle. Those 10-year data are, in our case, where our community is growing and changing so fast, not accurate anymore. I remember between the 1990 and the 2000 census, the Hispanic population in Northwest Arkansas increased by 790%. Okay? That's a big change in a community, right? And that impacts a lot of things. And so can you imagine why that number stuck in my head even this many years later? I use that number a lot. So we use American Community Survey unless you're told not to. I still have some funders. I think the Arkansas Arts Council still says, everybody use the what year are we in? The 2000 census. We're like, okay, but we all know it's out of date. I suspect they do that so it's a more kind of a level playing field, and probably because they also have budget decisions that they've made based on those data. That's just my guess. So what are some census geographies? So I'm not going to spend a lot of time here, but one that many of you may not be familiar with is that one between state and nation, and that's the metropolitan statistical area. That's for places like ours that have grown in funky ways, and the census boundaries and political boundaries haven't kept up. So when we talk about the entire metropolitan statistical area actually has exceeded 500,000, and that's a tipping point for a lot of things to happen at the federal level, so that's really important for our region to talk about that. I've also used the metropolitan statistical area around Tucson, for example. There aren't a ton of them, so it's super easy to go on the census website and just say, what are all the MSAs? I think there's like an Austin, I don't know what the name of the communities are around Austin, but like an Austin +4, their communities 1. So it just kind of recognizes places where communities that used to be distinct and might have different characteristics have kind of mushed together over the years, for lack of a better term. So as, of course, they can get much more specific than this. Census tract level for me is usually the most narrow that I get, although I have gone down one below that before. So I just talked about this. What is an MSA and why is it good to have one of those? Because it does allow you to talk about an entire region. And in our case, the region isn't just bounded by county lines. So I can't just pull together 5 counties and say, this is the data. So it's appropriate for some organizations as their service area. Yes?
So I've also found this doing, like using Career One Step to do salary research, that you can find balance of state areas for all the parts of your state that don't belong to an MSA.
Okay.
So, balance of state Southwest or balance of state. So if you are really not close to or covered in an MSA, you can find yourself typically in those BOS areas. And I'm not sure everything provides that data, but some things do. So where you can find it, so for example, Career One Stop, which is labor or Bureau of Labor Statistics wage information does include that. And
So,
I just wonder if others.
So that's really good information. I'm going to repeat for the rest of the people in the room and our live stream audience, and I'm going to hopefully summarize accurately. Martha said the Bureau of Labor Statistics enables you to search, for example, on wages outside of an MSA. So what parts of my state are not in an MSA? And if you're doing any services to rural communities, that could be a really important feature. She was also kind of wanting to ask the room in general, does anybody know if any of the other agencies provide similar search tools or filters? Yes?
In Ohio, for housing information and homelessness information, we have continuum of care, which is a HUD definition, and then we also have balance of state.
Okay, so through HUD's agent, through HUD, you're able to search, or is it a state level? So some states have it at the state level too. So we're going to talk about this later, but some states have like state data offices, and we'll come back to that. Very good. Okay, so go ahead, Kaylin, or just sell mine too. We planned this out, and I was supposed to remember which slides are mine, and yeah, I'm over 50 now. That didn't happen. So actually, we've pretty much talked about these already for you, so I'm not going to spend a lot of time here. At the very basic, no matter how simple your proposal is, you're probably going to put in some basic demographics. Where are you? Who are you serving? Maybe both. And then we have 2 examples here from you that Kaylin's going to talk about. One from 2 of our funders one was the Arkansas Arts Council, a state funder, and one was the Walmart Foundation, a corporate foundation funder.
Yes, so our first example is from Arkansas Arts Council, which is a state funder. It is funded by the state of Arkansas and the National Endowment for the Arts. They, in all of their applications, do request demographic data, but they are very specific in their requests. They want it to come from a specific census, and they want to see specific information. So it specifically tells you, use the 2010 U.S. Census Bureau data to transfer these demographic percentages onto the application. So it's a very direct ask.
And it's a portal. These are just, it's a field that will allow you to put up to 3 numerals or 2 numerals, no decimals, no explanations, just numbers.
Yeah. Walmart Foundation is similar in that it is an online form. It is a set of fields that require numerical entries, no opportunity for explanation. But the request is a little bit different. It asks for the total number of people served by the specific project. So they're looking at your audience rather than your community. They ask for the number of males versus females, the number in each age group, and it's broken out through by children, youth, young adults, adults and mature, and each of those has an age range that they provide. And then ethnic background, which models census data. Sort of.
And the age data the age categories don't match census either. So where are you going to get those numbers? For our arts and education program where we're serving students in the schools, every year we go, used to be me, now it's Kaylin, we go to the program team and say, give us a list of schools you're working in. And we go to the state Office of Education and pull down the demographics of every school, and at least we know that it's going to be 900 children and probably about 35 teachers. If we're getting funding for general operating, I can't tell you how many people my age came into a Broadway show versus how many people your age or your children's age. So we're doing some guessing.
Yep.
Yeah. Again, no way to write a narrative that says, thanks for asking, we really don't know. Thanks for asking, this is the best we've got.
And you can't put in all zeros.
You can't put in zeros. Oh, but now, actually, Walmart did just change theirs so that you can say, don't know, don't collect or something.
But not all fields have that.
Not all.
If you click to the next slide, it does have the example.
Oh, yeah, we gave you a screenshot. Yeah. But that's brand new. That unknown, unreported just showed up for the first time this year. We're like, yay! I have a feeling we're all going to keep using it, and then they're probably going to jerk it back away and say, well, now we have no data on who's giving our grants. But, yeah. This one? Mm-hmm. Okay. So I don't want to spend a ton of time here either, because even if you didn't go to the very good session before lunch on census data, that gentleman was an excellent presenter, and the slides are available to you in the app, and he had better slides on this than I do, with a lot more options of what can the census tell you. But I'm going to talk to you about them in the context of how you might use them in grant proposals, right? So we've talked about population. We've even talked about ethnicity, especially. When we were talking about the need for human services in our community to catch up to this sudden influx of Hispanics into our community, of course we needed to talk about race and ethnicity, right? Poverty, income, health insurance rates. So there are a couple different places you can get those, but you can get them from the census. Not the most current usually, but you can get them. We've talked about educational levels. I've used driving time to work before. Especially, again, serving rural communities or talking about labor development grants, workforce development, economic development. You don't know who your readers are, but at the federal level, they're often from one of the two coasts, or they're from major metropolitan areas, or they're all from DC, and they don't have any idea. They can just hop on the metro, take an Uber. They probably take an hour for them to get to work too, a lot of them, because they can't afford to live in the city. But they may not realize that the people you serve have to burn, I don't know, how many gallons of gas every day traversing this mountain range that when it snows, they can't get to work. I mean, you can just paint that story as detailed as you'd like, if it makes sense for your project. Home ownership rates, we've talked about that some more, and also as the gentleman before lunch, and I can't remember his name, that's why I keep saying the gentleman. I'm sure he's a gentleman. Also rental rates, so depending on who you're serving and why, that could be an important stat in your proposals. English language speakers. How many people in our community for whom English is their first language? Because what does that say about how I might need to structure my services if I knew that was a fact, right? Veterans, what percent are veterans? What percentage of people have a disability? What percent of them are raising their grandchildren? We talked about that. How many of them are single parent households? Did you have a question?
Yeah, can you get that information, grandparents?
Yes, it's in the census. Yeah. Absolutely, yep. One of those socioeconomic characteristics tables, it is in there. Primary occupations, industries. Again, for labor development or talking about economic development, if you want to say in this community, the primary industry is agriculture, or as it is in parts of southern Arizona, the primary industry here is mining. Well, what's happening to mining? Is it going down or is it going up? And how does that affect workers? And are they displaced? How many are receiving Social Security and or SNAP? Again, another indicator of poverty, right? Typically, if I'm working on a federal proposal that is targeted to people with economic need, I don't put in just one number about poverty. I pull all the numbers I can find, and I look, honestly, which number makes the best story for me, depending on who I'm serving and what kind of grant I'm going for. So if the number of single moms raising children under the age of 18 has the highest poverty rate, then I'm probably going to use that number if it's relevant to my population. But I will include, I'll stack the data and tell a story with the data. So poverty data tells me this. Per capita income tells me this. And I really like comparing per capita income or median income in my community versus the state or the nation. Because then you can say, okay, reader, in this table that I've given you, we'll talk about tables in a little bit. Yeah, in my community, people earn $9,000 less than their peers in Washington, D.C. That's $9,000 every single year of their earning life, right? It's not just the one number. It's the story about what does that mean for their entire life about access to health care, access to recreation, ability to retire, access to education for their children. It goes on, right? So many more things that you can get from the census. What is the census not great at? But you can get from other places. But it sounds like maybe now you'll be able to get it from this fancy new census tool that we heard about an hour ago.
We've touched on this already a little bit with some of the responses that you gave earlier. So opioid overdose rates would not be something that you could find in the census. Unemployment is something also that you can't really find in the census. So
it's there. I would say it's there, but I don't consider it the most current.
Current, yes. So the Bureau of Labor Statistics would be a better option for you if you're looking for that information. Health conditions and lifestyle choices, you'd prefer to look at your state's Department of Health. I don't know what that.
The BRFSS Behavioral Risk Factor Survey. Help me out.
Yeah,
Surveillance Survey. It's more of a lifestyle questionnaire, kind of that gets usually at the county level, I think is right, and it asks questions about how many fruits and vegetables, do they smoke, do they exercise. My challenge with the BRFSS, at least in my state, is it is often not updated regularly or erratically across the state. So we actually, going back to telling one of those stories about how we told a story in a federal grant proposal about how the poverty on one side of our county was worse than the other side, we also said, and by the way, our state hasn't had the resources to do a BRFSS lately, and so we really don't know what the needs are. So one of the things we got that grant to fund was for us to get the data, because the data weren't there. So I'm sorry I interrupted you, but that's okay. The BRFSS.
Specific information about school students or a breakdown of race or poverty at particular schools or in school districts, you would rather look at a state Department of Education data center. One example of that would be the free and reduced lunch levels. That's something that we use to show that we're serving students who are living in poverty with our arts and education programs. That's something that's important for our funders to make sure that we're expanding access to people of all income levels and socioeconomic backgrounds. So we would go to the Arkansas Department of Education website for that information rather than the census. And information about those you serve, so your specific client base, patron base, the people that you are serving, they aren't necessarily going to be represented by the census.
So where do you find those other things? Yes, ma'am. Yes, thank you for reminding us. The Youth Risk Behavior Survey is very similar to the BRFSS. It's probably not only in Massachusetts, but it's probably like BRFS in the sense that it's probably implemented, I would say, erratically. Probably not every single year for every single county kind of thing, but definitely look for that. So before I spend a lot of time going through the slides, I'm just going to do a quick technology toggle here and say one of the things that's in your supplemental handouts, and I think I'm doing a toggle, but maybe I'm not. I need my glasses. I had this, I told you, I promised, we practiced this right before. Here we are. Now, is that on your screen? It is not. So I might need one of the gentlemen who do AV to tell me how to switch. I know how to do this. I'm almost positive. He made it look really easy when he was here before. Still not there. Okay. So here's what we're going to do. I'm just going to tell you what's in this handout, and you can look at it on your device or in the paper that you brought with you, but I just want you to be aware of these resources. So the first few pages in here are actually an excerpt from a book I'm a co-author on called Writing to Win Federal Grants. And it's a couple years old now, but we had put together for you a list of data sources, and I thought, well, I've already done all this work, why not share it? I mean, why reinvent the wheel? So the caveat here is this is a PDF version of the print book, so I haven't gone to try to verify if all these URLs are still accurate, but they should mostly be accurate. So that's going to take you through the first couple pages of that handout, and this is not my computer, so I'm also trying to figure out how to scroll in a document that I'm not used to using, and it's really slow, so we're just going to keep scrolling. They are listed alphabetically by agency or by office within agency. So like the Office of Rural Health Policy has good information on rural health issues and statistics that will help draw immediate attention to issues. So we give you the office, we give you the URL, and we give you a sentence or two about what can you find here? What might you use this for? It's not all comprehensive, but it's sites that my co-author and I had used with regularity. We're also giving you here some private sources of national data, including the Kids Count Data book, the Pew Research Center, which there's a description there about how we've used it, and they've got some sub-centers, including the Pew Hispanic Center and their Center on Social Demographic Trends. I've used that for adoption of technologies, like how many homes have internet, how many homes have Wi-Fi, where do the children have access to ability to do homework after school, kind of thing. The Association of Religion Data Archives are out there. So that's the first couple pages. And then I added some new stuff as I said, oh, I know about some other sources that aren't in here. And these include where I get some of that stuff like opioid crisis information. America's Health Rankings is one place you can get those. National Center for Children in Poverty, National Institute on Drug Abuse. In fact, that's actually where I did my most recent citation for a proposal in West Virginia, because they're one of the worst ones on opioid misuse. The Rural Health Information Hub and the What Works Clearinghouse is specific for education, and the What Works is going to be specific to like a slide we have at the end here where we're going to just spend about 30 seconds or a minute on evidence-based practices and when and why you might use those and how you find those, okay? So that's what's available in the supplemental handout that goes along with your slides. And if anyone is having trouble accessing those or finding them, let me know. Now I think what I've done is I've broken the presentation. Of course I did. You know, you won't believe this. I started my professional career in IT and thought, I am never going to be one of those old people who just can't do two things at once and who can't like fix the computer while they talk and who get like, this is new technology. Yeah, I'm one of those people now. So here we go, back to the presentation. And we're probably going to start over from the beginning unless I know what I'm doing here. And so we'll... Yep. Are you seeing it?
It's still the same.
Awesome. Okay, so what I'm doing is I'm progressing through my slides here so that you don't have to watch me scroll through all of them. And here comes probably the guy to help me right now. I think I got it. I'm on the right slide, and this is where I want to be. Right? Where can I get this other stuff? Yep, that was it. Okay, we got it. So handout, that was the first bullet. State level offices. We've already talked about state offices of health. Again, it varies from state to state. Your mileage may vary, as we say nowadays. Whether there's an Office of Economic Opportunity, Center on Budget and Policy, State level Chamber of Commerce, other sources of data. I cite the New York Times and the Washington Post if it serves my purpose, and especially if I can't find anything else, right? Journal articles. How many of you have gone online to one of the, if you still no longer have a college student in your family or a grad student friend or can't get ILL, and go buy journal articles that you can cite in your proposals on best practices or learnings. Yes, ma'am.
You can almost inevitably get that through your public library card.
Public libraries sometimes have access. Yeah, some of them are behind paywalls, like the actual full text. So sometimes like it just depends on the provider. I can get the article, the abstract for free, but not the full article. The articles when I need them are maybe about $30. It's not, and you don't have to have them. I like to over prepare. Yeah. Trade publications and associations can be useful. They're the most objective source of information, Not always, but they've spent money on researching their field, and they've got things like the American Manufacturing Association can tell you probably better than anybody how many manufacturing jobs there are in this country and which way they went last month, right? And sometimes there are white papers too. White papers on homelessness, white papers on opioid addiction, white papers on after-school programs, white papers on fill in the blank. Someone has probably written one somewhere. Keep in mind, my strategy that I say over and over again is you're stacking your data. You're weaving in multiple sources. And why do I think multiple sources are important? Probably because I spent too many years on a debate team, let's just be honest. But also because I think it builds your credibility, right? The more data you can show to your case, the more credibility you show. So, is this my local planning? So some local sources of data. Again, this is a much more of a your mileage will vary. If you're in a high resource area or a metropolitan area, you're going to have more of these. If you're in a rural area, you're going to have some more challenges. But there are oftentimes regional planning bodies that do studies. The public or the university library is often a good source for you to go, and those librarians are trained to do research, right? You might as well use them. Ask them to help you. Previous evaluations or surveys you've done of your own clients / patients / students, patrons, whatever you call people that you serve. Exit interviews or surveys about their demographics and their needs. Community needs assessments. Who in your community has to do community needs assessments? I know you do, but name some organizations that you might be able to get a copy of one from. Nonprofit hospitals. Absolutely. They all have to do one, right? Where else can you get these?
The county.
The county sometimes does them. United Way, as we said. Or maybe there's a community foundation that's on the survey. So think creatively. Sometimes someone has already done a lot of work for you, showing the need in the community, and you can piggyback on what they've already done, right? Local regional news media. Maybe there's a newspaper's article. Maybe you can even get a journalist interested in a story on homelessness or after school, and they can do some of the work for you. How many of you have been able to get information from elected officials at the local, county, or state level? Sometimes they have staff they can put on projects. Sometimes they don't, right? How about your federal delegation? Have you thought of tapping into them for data about what's going on in their region where they've been elected from? So what are some key takeaways about the data? And I don't remember if these are Kaylin's takeaways or my takeaways.
These are mine. I'll
Okay.
go for it. So key takeaways. As Cheryl has mentioned, you often need multiple sources and types. So not just internal and external data, but different types of external data as well. You're looking at, maybe the census and the Bureau of Labor Statistics and local state departments of education and that sort of thing. You want to build layers of data to make a compelling case. So that's the example of X number of people or X percentage of people in our region are living in poverty. And of those people living in poverty, X number are uninsured or have no health care. Be as specific and local as possible. So like Cheryl was saying, in our region, if you look at it as a whole, some of the data might be inflated if you want to tell the story of rates of poverty in certain neighborhoods or specific areas of the region. So you want to get specific and local as possible. You can compare your data to state and national data to show gaps. So perhaps the rate of poverty in your region is X percentage higher than the rate of poverty in the state or the national level. That's something that you want to highlight. Use the most recent data you can find. Always and forever. That makes the most compelling case. And Cheryl, would you like to share your unofficial practice?
Yeah, and I think you've kind of already learned this about me. If I'm feeling like the data aren't really strong, I'll just pile on more data because it can't hurt, right? There's a question or comment from the back. I am not saying use 1 year census data compared to the 5-year data because you could pull up ACS 1-year data 2018, or you can also cite ACS 5-year data 2018. Guess which one I use? I use the one that tells the best story for me for my particular grant proposal for the particular community I'm using. So I have an answer that if you've known me or worked with me or consulted with me, and people hate it, it depends. I never do the same thing the same way every time. Is it replicable? Is it sustainable? Probably not. But we're going to make the story as unique as we can. Now that's because I'm a consultant and I'm usually coming in to do one federal proposal and I'm moving on. So it's been a really long time. Well, okay, I spent a couple years briefly at Walton Arts Center, but mostly it's been a really long time since I've had time to be at an organization long enough to build up the core data that tells the story for my organization. And now I know the story, right? So when I'm moving from college to college, comparing a 4-year private liberal arts college in Arkansas to a community college open enrollment in Tucson, I'm learning different things about those students that they serve. Does that make sense? So yeah. Another question? All right, we're moving on. So that's the data. How do you actually use them in these proposals? And so now that we're going to show you some examples, you're going to see some of this stuff that I've alluded to, like showing the gap and putting things in tables. We're also going to talk about, we were starting to kind of go down a rabbit trail of me saying, sounding really, really complex and multiple layers of data. So we're going to step back a minute and talk about some two ends of the spectrum.
Yes, the two ends of the spectrum that we often run into with grant writing. There are the online forms, which in terms of use of data, they're going to be less complex. You're going to have less room to provide a lot of data, so you need to be judicious in what you use there, to federal proposals where there is ample room to provide complex data and citations. So first, let's discuss online forms. We know that the hallmark of online forms is character limits. You only have so much room to tell your story, and they may have fields that are only for demographic information, but perhaps you can't provide a citation or you can't explain what that demographic information means to your organization or to the project that you're trying to get funded. Or perhaps they only give you an opportunity to provide in a field the number of people you're serving, and that it's that basic. How many people are you going to serve with this proposal? Oh, 10,000. It's another numerical field. You can't explain it or get where you derive that number at all. Perhaps,
like in the narrative,
Yeah.
you might pick one, because if you've got 250 characters to talk about community need, then you're not going to build a big case for need with the table, right? You're going to pick the one thing that tells your story that's most important. So maybe that's the poverty number, or maybe and you probably don't have room for citation. That was kind of the point there, was when you're counting characters, you're taking out citations and you're just picking the things, the top of the cream of the crop, right?
So an example of that would be, this simple sentence: XYZ town has high rates of poverty with 23.4% of area residents living below the poverty line. Very direct and to the point.
Yep, I use that percentage sign. I am not wasting characters on spelling out the word percent. And if I'm really tight for characters, that decimal is going to go away too, right? There's no citation because we don't have room for that stuff. So the flip side that I've kind of been leaning toward, because this is where I live in most of my world, are these government proposals. They are extremely data heavy, which is why most of the time you have a long time to prepare for them if you've planned out strategically. Often you're serving multiple communities or multiple counties or multiple schools, although what we just saw before lunch makes me think, oh, this might be easier. But when I said earlier your service area might be 15 counties, 10 years ago when I wrote that proposal for that university, I pulled and I had a table that was like all 15 counties, and I'm trying to do like the weighted average and the aggregate, and it was just really cumbersome. My government proposals typically have multiple data tables, and you're just going to see a couple. I mean, your needs section in a government proposal might be a third-year proposal, might be 10 or 12 pages, and each of those pages has 1 or 2 tables on it, depending on what they're asking you to provide. And that's when you're going to have data from multiple sources often, because you can't find it all in one place. And the citations are probably expected by your reviewers, and they may be required, and they may even be required to be in a particular format. I tell you what, I was writing to the West Virginia Department of Education for a 21st century grant, and they're like, and all your citations must be in APA format. You don't know when I graduated from college and when the last time was I wrote anything in APA. And I was an English major, so we wrote MOA, so that would be never. So I'm like, really? I'm going to spend my time on my bibliography making sure my comma is between I don't even know, outside the quotation marks or inside. Who has to remember that? Leave yourself time for things like that if you're working in the realm of government proposals. A lot of you, okay, how many of you are in the realm of government proposals? Okay, how many of you are what Kaylin's going to talk about, what I call the happy medium between those portals and a really data-centric government proposal. How many of you are just kind of doing, okay. So we've got some stuff for you too. Don't get freaked out. If you need to present complex data, my personal experience and my personal prejudice is almost always you put that in a table or a chart. Because if you, and this is an example, you start writing this, when I start writing the sentences and I'm like, X% of people live in poverty, and of this percent of people, X% of them don't have health care, and then this percent, and I start going, oh my God, nobody can follow this, right? Which is why in that proposal excerpt you saw earlier, I pulled out that community snapshot, because it was simple. And why, if I'm comparing multiple counties or showing you the data from the 5 schools we're serving compared to the state, compared to the national, that's immediately going into a table. It can make lots of information less overwhelming. Don't fall to the temptation. Don't just take the automatic chart that's spit out by Excel. Spend some time making that font bigger. In fact, you probably have to make your font what? For a government proposal? 12 point. And that's not what Excel is going to spit out, especially not once you've copied and pasted into your Word document. And be very clear about where the data came from for each element in that table. So I'm going to show you some examples about that. And then I'm also a very big believer of don't just throw a table in there or a chart and expect the reviewer to get the information from that you want them to get. It may be obvious to you. So unless I am under extreme space limitations, I do a table narrative, for lack of a better word. As the table below shows you, 19% of the people in our community live in poverty, and this is 5 percentage points higher than the national or state average. There may be 17 things going on in that table, and I want the reviewer to see these 2 things. What's another reason that you're going to present the data in 2 ways like that, a visual way and a text way?
So that they have more options to absorb the information.
Okay, so your reader has more options to absorb the information. That's a really good answer that I actually hadn't thought of. What's another one?
Some are visual, some of your readers are visual.
You're appealing to different learning styles and different communication styles. Some people are visual and some people are more text-oriented, and you don't know who is reading your proposal. Yes, in the back. Reviewers don't spend a lot of time digging to your proposal, so if they see all the information in one place in a snapshot, that's easier for them. Is that an accurate summary? Yes. That is a fantastic piece of advice that I had not thought of. If someone is vision impaired, they may be using a screen reader. So that means the computer is kind of like Siri, is reading to them what the document says, and that screen reader may not be able to interpret an image. Very good point. I like that. So if we're all about diversity, equity, and inclusion, let's be inclusive of all of our readers too, right? The caveat of all of this, of course, is when you have the space. You do what you can with the space that you have. So here's one of my examples of one of my fun tables, which is 4 different schools. They have different but similar characteristics. I'm sorry, because I promised the poor videographer I wasn't going to do this, and here I am, over here by the screen. Compared to the state, compared to the national. Do you think I can get free and reduced lunch rates for nation? Yes, I was able to. Do you think they came from the West Virginia Department of Education? No, they did not. So the data about the 4 schools, I keep turning my head and getting away from my microphone. The data about the 4 schools came from one source, and there's a little letter that says that's where this came from. And the data of the state and the nation came from another source, and that's where this came from. And I have a little line that says, okay, reader, we're shifting gears. Now I'm not going to give you data broken down by school, because I can't tell you the poverty rate by school. I can tell you the poverty rate in our community is this, and so on. And so this was accompanied by text that was longer than this, but is the example that I told you earlier. You give them the numbers, and either before the table or immediately after the table, tell them what the numbers say. At least the most important parts. And because I put all the citations in the table, I don't necessarily have to repeat them in my text. Does that make sense, everybody? That's just one example of putting it into a real proposal. And I was supposed to let you do that, wasn't I?
No.
Okay.
You weren't. All right, so on the spectrum of proposal complexity, let's just say, you have have the online forms to one end and government proposals to the end, but in the middle you have the happy medium, which is where most of your proposals will likely fall, where you have some space to provide the statistics or the data that you deem as important to telling your story, and you can provide citations or not, depending on what is best suited for the particular grant, if it's required or not, or if you think it's important or not. And you use data in these proposals for two purposes. One, to establish conditions of your target community or population, and two, to document the need among your clients. So for example, in a healthcare proposal, your target community, you might provide poverty rates, insurance rates, or diseases in the general population. So that would all be external data. If you're talking about your client specifically, you might provide incidences of disease among your patients. That's internal data that you've collected. But always remember to balance the numbers with stories, because that just provides a more full picture. So we have examples here of one set of one text that doesn't have supporting data and the same text with supporting data. And I'll go ahead and read each. The first is need text with no supporting data. Many people in our community live in poverty, and many still lack any health insurance coverage. Among this population, diabetes and heart disease are prevalent conditions. That same text with supporting data is, here, 23.4% of individuals live in poverty, which is much higher than the state average of 16.9%. 19% receive SNAP benefits, and almost 1 in 5 still lack health insurance coverage. The Department of Health reports that diabetes is increasing in this county, which is up from 11.6%, up to 11.6% from 10.3% previously, and also reports that heart disease is the leading cause of death in ABC County.
So remember your English teacher saying, be specific. We have a lot of many's and prevalent with no measurement whatsoever. Now, this was a lot of numbers, right? Recall, this is why we had that little community snapshot to accompany this dense paragraph. But it gives you much more specificity. It also gives you ways to set objectives, right? If we know what the incidence was, if we think we're going to impact the incidence now, we can talk about an amount of change. So just kind of the recap of this section. The purpose primarily is to show something in your community is terrible. Hopefully, not hopefully. In your case, for the purpose of getting points from your reviewer, hopefully you've managed to find something that is worse in your service area than it is somewhere else. So you can say, we really need your help here. Provide statistics whenever you can. And as I said, do the comparison whenever you can. And also, I broke this rule, which is why I feel free to say this in the final bullet. Learn the difference between, is this more than 2% different, or is it 2 percentage points different? Because someone will come back to you, some reviewer is going to take off points someday when you get that. I used it incorrectly here, by the way. So, citations. Whether or not you cite your sources will depend on the funder and space. Some require it, some don't. And that's what will largely determine whether or not you're going to provide citations. The style and format is usually not dictated, but if it is, you need to do what is requested. So if APA is requested, learn APA. I just bought a book.
Keep your sources as current or recent as possible. Usually no bibliography is required, though if you're talking about federal grants, it is required often.
Depends on the funding agent. Depends. Remember, it depends.
The National Endowment for the Humanities, it absolutely is. And then there are a variety of styles that you can use, citation styles that you can use. It's not just your traditional academic citation styles. Yes.
So if you Google citation builder, citation machine, you don't have to learn those. You just put in your components and it generates.
So there are plenty of online resources of Citation Builder, Citation Machine, in which you can enter your type of citation and it will help you build it. In my particular instance, I was using some really arcane and complex things that I couldn't find in any of the builders, so I bought a $15 book and it's on my shelf. And maybe I'm just old, like maybe nobody else under 50 would buy a book, but I bought a book. Thanks.
Citation Builder and Citation Machine is free.
Oh, that's just an example of the terms you use. Most academic libraries around the country offer this service, so there's literally hundreds of these out there.
Okay, so those weren't the names of actual products. We're repeating for the rest of the room. She's saying those are search terms you can use and that most academic libraries will offer an online service for you to help build your citations.
So some styles that you could use are inline citations where you have a parenthetical citation at the end of your statement, such as in the first example where U.S. Census from 2018 is cited, or you could just cite the name of the study in the text. For example, the Kaiser Family Foundation noted in its 2016 report, Oral Health in the U.S. Key Facts, followed by the quote or the paraphrasing that from that report that you're going to use. It's also an option to use footnotes if you're not using an online form or you're submitting a proposal that is basically in a Word document where you actually have the opportunity to use footnotes. Those are certainly an option. You always want to say what the source is and what you found. So, for example, in 2018, when you're using internal research or data, you always want to know what the source is and what you found. So in 2016, we performed an extensive community needs assessment to identify gaps in services for at-risk children and their families. So you're saying what you did, when you did it, and what you found in that statement. The 2018 survey of the target high schools revealed serious gaps in academic support, so you're noting that you did a survey in 2018, and this is what you found.
So those are some examples of inline, what I call, for lack of a better term, inline citations, except for the one footnote. And then I've already given you an example of using citations in a table. This is another model where instead of having all the little letters that say this cell came from here and this cell came from here, fortunately this all came from the same place. So I just have a row at the bottom of my table that says the source is this. Now, federal proposal writers who have to produce double-spaced narratives, why is it fun to be able to put your citation in your table and not in your narrative text? Because you can often single-space the tables. Good answer, right? It's crazy what we spend our time worrying about, isn't it? All right. Citing multiple or confusing. Yes, ma'am.
If they don't specify in the rules about how you cite your sources, do you find that there's any preference between the inline versus the footnotes?
If the funding agency or the funder does not specify in their rules the style of citation you use, is there a preference for inline or footnotes? What do you think my answer is going to be? It depends. I'm not trying to be snarky. It really does depend. If you have a lot of familiarity with a particular agency, you're going to kind of get to know their culture and their style. I'm not consistent. I tend to, if it's a long, like that manufacturing in Arizona with a long URL, I'm always going to put that in a footnote because it'll take up less space there and it's a little less intrusive. If it's quick and easy, U.S. Census 2018, I'm probably just going to not bother with a footnote because every time you make a reviewer jump around, it's harder for them to keep focused. So I may not be the best person to do this, but I've already been really upfront about the fact that I'm a very situational person, not my ethics, just my practices, like what do I think makes this particular proposal the easiest to read? That's ultimately my criterion. What is going to make this the easiest to understand and get all the information in? So that was a long, not specific answer. I'm sorry. Yes, another question.
When we talk about the fonts in the chart,
Yes.
I think federal grant, does like a 12-point apply to it?
The question is when we talk about fonts, and I said sometimes you can single space in the table but not in the narrative, and she said, does the 12-point apply in the table if it applies to the narrative? And you guys know what my answer is. It depends, and it really does. Sometimes the agencies are very specific in the guidance and say everything must be double-spaced except these things, or everything must be double-spaced, and you're like, really? Everything must be 12-point. Sometimes they will say right in the NOFO, but you may use tables and charts, and they'll either tell you can go down to 11 or 10, and then they'll get on the webinar and say, okay, we said you could do 10, but really, don't do that. Again, the biggest criterion is readability. So follow the rules, look for the fine print. Every time I get a NOFO now, I do a word search for every variation on lines, paragraph, font, space, and make sure I haven't missed any reference, because how many of you have got a NOFO and it is internally inconsistent, right? On these three places it tells you that this abstract can be single spaced, but in this one place it tells you everything has to be. So I collect that and document it, and it varies. It varies not only from agency to agency, but program to program within agency, and from this year to next year. So you just have to really read carefully. So we have we have about 10 minutes left.
Yes.
Do you have any questions from online, or should I keep going?
Somebody said about cherry picking data that just came up. Can
What?
we talk about cherry picking?
Can we talk about cherry picking data? Was that all the context they gave me there?
Yep.
So I'm going to go with that as a positive. Yeah, I totally cherry pick data. Does anybody not cherry pick data? Again, I'm not trying to violate ethics. I don't lie, but I pick the data that tells the best story from my organization and my particular need. So I'm not sure exactly what they were asking. They can follow up with a more specific question if they want to. This is just one more example, you can take it with you, of how there was a lot of data happening in a table and we couldn't get all the data from the same sources. So we marked it with different little footnote labels to try to help you, because sometimes the reviewers are really skeptical. And you've got to be very precise, and sometimes they'll follow the links themselves to check on you. Okay. So the last few minutes I was going to spend on something that is a lot of you don't have to do, but some of us are responsible for using data to set baselines. So I just wanted to talk about that for those of you for whom that is relevant. So why do you set baselines in your proposal, or why do you set or refer to benchmarks in your proposal? Primarily so that you can demonstrate improvement as a result of the intervention you deliver, otherwise known as what? Writing an objective, right? So if we know that 66% of the incoming freshmen who test into developmental mathematics have GPAs of less than 2.0, if we deliver services to them for 2 years, do I hope to get that number down to realistically 64%? I'm not going to cut it in half because they still have high need. But if I just set the objective at 64 and I've never told the reviewer the baseline, they have no context for why that objective is the right objective, why that is a thing for me to attain, okay? Also, you can use it to demonstrate that those you serve outperform those that you did not serve, otherwise known as comparison groups, or dare I say, possibly leaning almost into quasi-experimental, which don't run away. I'm not going to talk about that. So, one objective, 75% of participants served will persist from one academic year to the next. The baseline to those not receiving services is 66.9. And in fact, this particular agency requires you to include the baseline for that reason, because you're setting the objective wording is required by the agency. The only thing you can do is put a number in, and then you get to write a narrative telling them why that's the right number, why that is ambitious for the people we serve, but why it's attainable given the services we're going to offer. For example, any TRIO writers in here recognize this? Yeah, okay. Also, you put it in your evaluation plan. So how are we going to evaluate the success of our project? Well, the graduation rates of the students we serve will be compared to, or you could say benchmarked against, their peers who did not receive services. And then we say the baseline, which is assumed people not receiving services, is 54%. So if we get over that number, we're going to say, look, we're doing a better job. How much of a better job is worth the investment you just made is, a variable situation. Okay? These baselines and benchmarks, the slide says often, I want to say almost always, based on internal data. Although you could elect to benchmark your performance against a professional association or against a national standard as well, right? So hospital readmissions or graduation rates for 2-year colleges, you can also benchmark yourself against a national standard. Okay, final one, demonstrating evidence-based practices. How many of you are now being asked, even by your non-government funders, to prove that your described intervention or your program design is based on evidence-based practices or best practices or promising practices, right? So this is a whole nother level of research we're having to learn how to do, and a whole different type of data we're having to learn to put into our proposals. So you have to first go out and research the evidence basis. So for the way that we want to deliver our after-school programming in this 21st Century Learning Communities grant is based on identified best practices by the After School Institute that says a strong after-school program has these characteristics. For example, the funder may, and often does, say, you have to get proof that your practice is an evidence-based practice from this source that we have pre-qualified. What Works Clearinghouse, which is not very clearinghouse-y, not very complete, not much that works is in there. This usually does require citations. Again, they're not usually prescribing the form of those citations, but you have to tell them where you found this evidence. And you may have to use some narrative space describing how your program aligns with that model. So if the Institute of After School Program says the qualities of an after-school program or a quality after-school program has these 5 characteristics, and I say, we found this out, the next thing I'm going to say is, our program has these 5 characteristics, and I'm not just going to say that. I'm going to tell you exactly, specifically how I have every single one of those characteristics. I'm not just going to say, yep, we're just like them. Not sufficient, not specific enough. And then you must understand the differences between data and evidence, the data and the evidence that are being shown. So here's one proposal excerpt from one of those 21st century learning community projects that says one element, it was one tiny piece of what we were going to do with our program was we were going to use manipulatives in the math tutoring. And so we found evidence out there that says using manipulatives increases math achievement. Basically, I'm summarizing. We found 2 studies, one of which came from the What Works Clearinghouse and one of which came from the National Council for the Teaching of Mathematics. And why do you think I cited both? Because probably I couldn't find something that said exactly what I wanted it to say, right? Or one of them may say that half of what I'm doing is smart, and the other one may say that the other half of what I'm doing is smart, and so I'm kind of cobbling them together. Or maybe I'm just wanting to build more than one authority has reached the same conclusion. If that makes sense. So, we dumped a lot on you right after lunch, so thanks for hanging in there with us. We do have a couple minutes left before they have to turn off the live stream for questions. You should feel free to leave. If you want to stay and ask questions even after the 2 minutes, I'm happy to talk to you, and Kaylin is too. Any more things online, Alicia? Any more questions or comments from you today? We thank you very much for coming. As I said, our contact information is here. Do feel free to reach out. Come up and talk to either one of us before the end of the conference. We appreciate your attendance today. Thank you.
Yes, thank you.